Good evening. My name is Angela Ochoa. I'm a student at United States University pursuing my Bachelor of Science in Nursing. Today I will be reviewing Jean Watson's Caritas process number 1, cultivating the practice of loving kindness and equanimity toward self and other as foundational to Caritas consciousness. According to Jean Watson, a direct quote, love is the highest level of consciousness and the greatest source of healing in all the world, in 2008. Jean Watson has been pretty pivotal in developing caring theory. She began with developing 10 curative factors, and then over time expanded those factors into Caritas processes. She realized that nurses simply just can't just have the factors. It's something that, as an ongoing process, we continue to develop and evolve throughout our nursing careers. The curative process, cultivating loving kindness and equanimity towards self and other as foundational to Caritas consciousness. What does this mean? It means that it's a process of knowing oneself, of understanding oneself, of loving oneself, and in that process being in a position to love and care for others. Having this knowledge of self allows for greater consciousness in the caring process of others. Yeah, I think that's okay. So if love is the foundation, then what is love? So this question has been asked for many, many years, all the way back to Greek philosophy. Socrates and Plato, they both examined love in depth and the meaning of love, types of love, expression of love. But Aristotle was the first to actually describe the benefits and importance of self-love. He talked about it for the first time, self-love as being a positive thing instead of being selfish. He talked about the difference between selfishness and the positive aspects of self-love, and in doing so, doing good for others. In more recent time frame, Erich Fromm, a humanistic philosopher, he also expounded on and discussed self-love as respecting and knowing oneself. And in his description of the human experience, it was important to have that self-love to be able to know and respect others. Maslow's concept, Abraham Maslow, his concept of striving for self-actualization, this is related to self-love. He called it self-actualization, but it's a process of striving for and being one's best self. And in doing so, you must respect oneself, know oneself, love oneself. So Jean Watson talked about nursing and this particular Caritas nursing process as love and caring, and love is caring, according to Watson. And through that knowledge of self that we've talked about, we can then in turn care for others. So she's applied this to nursing in equating love to caring. So self-care, self-knowing, can lead to the empathy and understanding of others, allowing nurses to care for others with a greater understanding and a shared human experience. So how do we develop this knowledge of self, this self-love? We do this through spending time with ourselves and doing it in a meaningful way in which we're examining ourselves. So through breathing exercises, an extended amount of time alone by yourself, concentrating on your breathing, a lot of times that can really bring out some deep motivating factor that's been bugging you for days, and it can help bring that out in that process. Centering, focusing on yourself for an extended period of time guided meditation, self-guided meditation. And then I really liked Jean Watson's, she talks about moments of intentions throughout the day. And these are moments where you take just a few moments in between at the beginning of your day and thinking about how you're feeling and what's affecting you that day and how you're going to carry that into your process with patients. Um, Pausing before you walk into a room with a patient, examining again how you're feeling in that moment, how you're best going to be able to be connected and supported for that patient. And then I get the end, kind of processing the day, what happened, how were you interactive with your patients, how did you connect to your patients, what may have prevented you from developing a deeper connection with your patients. So I had cancer. This for me is a very significant event in my life, and um, it this particular cancer prevented me from being able to have children. And the medical process of becoming cancer free is what I focused on while I was in that process. But it's taken me years to examine and understand and feel the loss and the grief of what that meant to me and how that affected my life. And even now, I need to take time, and I do take time to um, focus on that and think about that and re-examine those feelings that motivate me in ways in a nursing position specifically, that these past feelings can still affect how I connect with others. I have a specific example of a patient of mine that just had a baby, her very first child, and I found myself in interacting with her. I would pull back, not meaning to, but I would pull back from meaningful connection with her, and I recognized that within myself, I had some unconscious need to protect myself from feeling that loss again. And it is extremely important, though, to be able to recognize that and what motivated my hesitation, where it comes from, what it means to me. Without acknowledging it, I can't accept it and give myself permission to be okay with that. Once I can do that, I can find myself no longer hesitating with her, and I'm able to be there for her in a more meaningful way, accepting those feelings within myself, understanding that's what the hesitation is, that's what was preventing me from keeping or developing that more meaningful relationship with that patient. Being there for her in a meaningful way, I had to re-examine those feelings and understand where that was coming from, and being okay with those feelings. That really was able to help me develop that deeper connection with my patient. A personal experience in kindness in the workplace. So we develop a Caritas consciousness through this process of self-love, of self-knowing, and applying that deeper understanding and acceptance of self to others in a loving and kind way. I think that kindness comes in as you become aware of your own self, being able to accept yourself without judgment, allowing yourself to be imperfect, allowing yourself to just be. This kindness toward yourself will allow you as a nurse to also be kind and accepting of our patients as they are. In my current position as a nurse manager, I currently have someone in my life that's in my work experience that is going through a health crisis of their own. And having gone through what I went through, the cancer experience I just described, I kind of understand this health crisis that this person is going through, and it allows me to support that person in probably a kinder, gentler, more supportive manner as a manager that I might not have done if I hadn't experienced a health crisis myself and examined the emotional content of what I went through. Having an understanding of that allows me as a manager to pay attention to whether or not that person is able to support their patients, and having that deeper understanding, that greater consciousness of what that person is going through, and of myself in that process, and of that person as an extension of that person's process as well. Um, Helps us develop a more trusting, supportive, symbiotic relationship together, a deeper understanding of each other and and what we both have gone through, and it strengthens our relationship as coworkers and as manager employee. Um, so, having said all of that, I'll leave you with this, that I really truly feel that this particular Caritas process of Gene Watson's really does serve as a foundation for all that we do in nursing. We can come back to this as each and every time we interact with a patient. We can come back to this each and every time we learn a new skill, because this process of understanding yourself, what your hesitancies are, what might be preventing you from developing that deeper connection with your patient, that self-knowing and having that deeper understanding is the basis of nursing, not just healthcare, but nursing specifically. It helps us truly be able to care for our patients. Thank you and have a good afternoon.